Hello and welcome back to Kitsap Commissioner's Corner. I'm Kitsap Commissioner Charlotte Garrido, and you'll recall that we were talking in November of 2013 with Sue Schultz and Doug Washburn about the newly adopted mental health, substance abuse, and therapeutic drug courts tax, so that we were creating a base of funding to address a very, very important topic in our community, and that is the newly broadening subject of mental health disorders and substance abuse, and how we can address that in a positive way in our community to assure that we are reducing the impacts of this new crisis. Sue Schultz from the League of Women Voters in Kitsap County, who had done a previous survey and study about this topic in Kitsap County and recommended to the commissioners that we consider what to do about this issue. They recommended that we look at how to put together a program that could address a strategic approach rather than piecemealing our programs. We adopted a tax, a sales and use tax that will raise about $3 million per year for us to be able to do this work. There was a steering committee of professionals that helped us understand where the issue areas are, where some of the huge gaps in the community are, and the League of Women Voters work was essential to our understanding as well. We talked about how to ask the community to come together to address this issue and what kinds of projects would be valuable. And we issued a request for proposals. Those requests, responses to those requests came back to us, and just a couple of months ago we were able to issue contracts for those projects. Today I'm delighted to be able to have some of the project representatives here to be able to talk to us about the projects that they have recommended and that they plan or already are carrying out. So we will start with a brief panel discussion with three wonderful people who will tell you about their projects. First, we have Kristin Schutte, who is with Olympic Educational Services District, and they have a project called School-Based Behavioral Health. From Martha and Mary is Paula Rimmer, and she will talk about their Geropsych Success Program with seniors. And third, we have Barbara Malich, who wants to talk to us about, from Peninsula Community Health Services, who wants to talk about their Integrated Drug Awareness Program. Welcome, ladies. Thank you so much for joining me today to talk about this. I'm delighted to have been able to review the programs that you have in front of you, to sign the contract to let you go ahead with the work that needs to be done. We know that there's a strategic approach, that these programs are independent and yet they are overlapping in some ways. And I'm wondering if you will each tell us a little bit about the approach that you're taking and some of the issues that you're thinking that you're addressing in this big problem in our community. Barbara, would you like to start?
I'd be happy to, Commissioner Garrido. My name's Barbara Malich, as you said, and I'm the CEO for Peninsula Community Health Services. And Peninsula is honored to have been selected to receive some of these funds. The title of the program that will be funded through these resources is called the Integrated Drug Awareness Program. It's a new program, not only for Peninsula, but in this county. Although it has been proven and is it's a scientifically based program that in fact has seen great success, not only across the state, but across the country. The name of it is, our name, the Integrated Drug Awareness Program, focuses on both alcohol and other drugs. And what we will do is called the SBIRT process. Everything has an acronym. SBIRT stands for Screening, Brief Intervention, and Referral to Treatment. So what we will begin doing is extending our screening programs, which we are already doing for our patients, all of our patients in the behavioral health arena. We are going to be extending that into substance use. And it's a process where you come in, you answer 2 questions as you're starting your medical visit. And if you, depending on how you answer those questions, there may be 9 more that can talk about your substance use, or 9 in alcohol, or 9 more that can talk about your drug use. We know that this is a critical need in our community, not just with our patients, but with all patients across the community. But because of our size, we're able to be a real first step in terms of bringing this to the broader medical community. There are some places where it's used in emergency departments, but we are looking at integration into primary care. That the word integration is the buzzword of the moment. And as we're looking at behavioral health, substance abuse, and the integration of that into primary care, what we're finding is that people can have all of their needs met, or at least all of their needs identified, and then we can be more efficient and effective in getting people connected to the right resources in the community. This is going to start out, our goal for the balance of this particular contract is to screen 12,000 adults.
Wow.
Now, we don't know that, I mean, we obviously know that there are issues with kids, and Kristin's going to talk more about that. But we need to just bite off one piece of the apple at a time and prove that, get the skills and the screening tools, and then identify appropriate referrals to treatment for the adults in our community. That piece about referral for treatment is always a challenge. It has always been a challenge in our community, but we hope by being able to be more focused and more perhaps engaged is the right word, where we can build stronger links with the care providers in our community, that those limited resources can be better utilized. That's our goal.
So first steps?
The first step is completed for us. We have hired a program coordinator who is one of our existing clinic coordinators who's moving into this special focus area. She'll be reaching out into the community to learn much more about all the resources that are currently available in the community. And then in a couple of weeks, our providers will be trained on how to interpret the tests, and then we'll begin by the end of September.
Thank you. Kristin?
Good afternoon, and thank you for inviting me to be here. So as you introduced me, I'm Kristin Schutte, and I'm the Student Services Director at the Olympic Educational Service District. And our project is focusing on 10 of the greatest need elementary schools and 7 high schools in Kitsap County. And we're targeting resources at those locations basically because of the need that is demonstrated through suicide risk, substance use issues, and concerns that are happening in our local communities. And the project will also provide professional development training and opportunities for schools and parents to learn more about the warning signs and symptoms of substance use, and also early identification for mental health and referral. So overall, the purpose of our project is really to promote the emotional health and well-being of the children and youth in our county. And this is a collaborative project. So we are partnering with Kitsap Mental Health, and Kitsap Mental Health will take the lead on hiring the specialists, our counselors, to be housed in the elementary schools, in the 10 elementary schools. And then the ESD is hiring the student assistant specialist, our counselors, and they'll be housed at the high school. And the student assistant specialists do more of a screening for substance abuse and mental health because it's more prevalent at the high school level. And then in the elementary schools, the mental health specialists will be the ones that are doing the screening, referral, and counseling support. So both programs will be providing on-site counseling as well as referral into the local community resources that are available out there. And then the other partnership is, of course, our schools. So the schools are allowing us to provide the service at their site. They're providing the confidential, secured space for the staff to meet, and then allowing children to be pulled out of the classroom when needed, and necessary, as well as focusing on academics, which we know is important, but also helping the schools and these children. And then also our Kitsap Public Health District will be doing the evaluation, the project. And then overall, our intention is really about increasing the access to services, because what we found in meeting with our local districts and our local school counselors and school principals, as well as our Kitsap mental health partner and drug and alcohol treatment services, is we know that there's a barrier to accessing services, so we really want school-based services for these children and youth in our communities. We also want to, again, increase the ability for our schools to respond to behavioral health issues and needs of those students, and then assisting the schools with suicide prevention plans and training staff and building their awareness. And then at the local level, even increasing our community partners as well as our parents' awareness about those early warning signs. And our overall hope is that children will get help sooner than later through this process. And then again, we really want to increase the overall behavioral health and well-being of the students in our community. And then I also want to thank those who awarded this grant to us or contract to us for this opportunity to really make a difference in the lives of children and families in our local community.
Oh, thank you, but I think it's really an essential program. So I'm curious about what your first steps are, and what are some of your measures for success?
So our first steps are, of course, hiring staff. So both Kitsap Mental Health and the Olympic Educational Service District have been conducting interviews this last month. And we're in the process of hiring, and I know Kitsap Mental Health has too. Also, myself and Michelle Dower, she's our program manager, we've both been out in all the districts meeting with them to go over the program, review the project goals and objectives, making sure that we have secured site locations to meet with the students, and then also scheduling time, like when are we going to do the suicide prevention training, when are we going to work on suicide prevention plans, and talking about that, which those will probably happen in the next, over the course of the school year. And then, so you asked about our measurable outcomes?
Yeah, just give me a couple of the benchmarks you think that you're going to be, or how are you going to measure success?
So we actually are setting up our evaluation design. Both of the counseling programs have a pre and a post test to measure the health and well-being of the student, and there's an assessment tool that they use to measure that. And so our Kitsap Public Health Department will be the one that creates that tool. Okay. And then we also are looking at, again, getting feedback from the school faculty and providing information on how do we build their capacity and understanding of the warning signs and how to refer and access those resources.
Great. Well, we look forward to seeing what some of the successes actually are. So now we go from students, and let's take a look at seniors. Paula, can you tell us a little bit about the program that Martha and Mary has, the Gero-Psych Success Program? Gero-Psych, now what the heck is that?
Well, Gero-Psych, okay, so that's two words that we've taken and chopped off, but it's geriatric psychiatric services. So the population that we are that we will be reaching with our program is those seniors in our community who have complex medical and behavioral issues. So for example, it could be dementia or early stages of dementia. There may be some other mental health issues that they have, and then it could be that their behaviors are really exacerbated by complex medical problems, medications that they're on, and so what happens is they start to develop behaviors that really become a risk to themselves, to their caregivers, to our community, and generally to our community. And what has been happening in Kitsap County, and this is also something that's happening around the state and is identified as a significant problem statewide, is that because of these complex medical and behavioral issues, these seniors are really unable to be cared for in their home communities because the facilities that are there to care seniors at other, with other kinds of needs are really not physically equipped to do that, and nor have the staff been appropriately trained. That's not to say that all of our care facilities in Kitsap County and around the state and country don't deal with some level of this, but this is a pretty significant need. And so what's happening here in Kitsap County is that they are being boarded, literally living at the at Harrison Medical Center or in their emergency room for days on end, because
Expensively so.
Expensively so, and with no real option in sight for them to return to a more normal sort of living situation or really get themselves stabilized. So perhaps they could even go to another setting here in our community, maybe a group home, or go to another skilled nursing facility. So, so let me tell you a little bit about how we're doing this. We have partnered with Harrison Medical Center and Kitsap Mental Health to build this behavioral health program, this geropsych unit in one of our units in our health and rehab center in Paulsbo. And what we did in terms of gearing up for this, because we were really interested in this kind of program and we knew this was a need in the county, is that we took trip over to Yakima to visit the Garden Village. It's a program that's been doing this successfully for 12 years, and learned about that. And our next steps are to train our staff. And let me also just add that in addition to training our staff, we want to partner with other organizations in our community who are involved with senior mental health, so that what we can create here in Kitsap County is a whole, network, a whole set of resources to ensure that this boarding happens never if possible, but you can see situations where somebody might be in an emergency state and you need to go and get somebody stabilized now. But ultimately what we would like to do is bypass the hospital altogether if we can, and then offer this robust service in our community. So we're training our staff. That's the first step. And then we will do physical improvements. Those have also already begun. And we anticipate we'll be able to accept the first clients in November, and then we'll be reporting back in February, I believe. And we anticipate being able to serve about 14 seniors as we begin the program, and then ramp that up to 40.
Thank you so much. Well, this is a delightful conversation to hear how much there is that's going on to prevent, to intervene, to offer therapy, to actually have care coordination. Thank you for presenting your programs. I look forward to checking in with you later. We have a couple of more guests that we wanted to chat with. We've heard about the people going to hospitals when maybe that's not the best place to take care of the problems. We're also hearing that warehousing people in jails or incarceration and law and justice is maybe not the wisest use of our tax dollars, nor is it putting people back into a positive role in our society. So we're going to move on. Thank you very much, and if we have time later, we can continue this conversation. But if we don't, we'll do it another time. And let's talk about a couple of folks who are working with a New Start Jail Transition Service, and actually what some police officers in Kitsap County are working on to work together. Thank you all for being here, and
Thank you.
I do look forward to staying in touch with you and your programs. Welcome back. We have two more guests to talk about their programs now. Robin O'Grady is with West Sound Treatment Center. Their program is New Start Jail Transition Services. Chief Steve Strachan is with the Bremerton Police Department, and he is with the Law Enforcement Crisis Intervention Training Program, which is a regional initiative. Chief, would you like to tell us a little bit about this strategic plan that you're working on?
Sure, I'd be happy to, Commissioner. in terms of the continuum of programs that the mid-tax is funding, this is obviously one that I feel strongly about as a law enforcement officer and as a chief. We recently rolled out what's called a Crisis Intervention Officer program countywide, and this is a critical part of it, and it's really going to fund the most significant part of the Crisis Intervention Officer program. So everybody knows that mental illness is a huge issue, and that the intersection with mental illness and law enforcement, and sometimes unfortunately violence, is one that gets a lot of attention in the media. There are obviously too many horrible stories across the country. Cafe Racer, Aurora, Colorado, Newtown. Those are the things that really raise a lot of concern with people. But of course, those are extremely rare. But very, very common, unfortunately, is interactions between individuals suffering from mental illness and law enforcement. And sometimes they go very wrong, and sometimes they become violent, even when the officer does everything right. But we're asking the question that everyone's asking: what can we in law enforcement do better to better respond to individuals in crisis, to persons that might present in a different way than others, that are drug dependent, and often that's combined with mental illness issues, of course, the codependency or symptoms occurring at the same time. So we ask that question with an open mind, and I think a lot of departments across the country are. And we're not reinventing the wheel, but what we are doing is taking the best that we've seen and implementing, again, countywide, a Crisis Intervention Officer program, and the training that will be funded through the mid-tax, implemented by the commissioners, will be really the center of that. And if I could, can I explain a little bit about sort of how that's going to work?
I would love to have you do that.
There's two ways to go at this, and again, nationally, many departments have looked at this. One is to train every single officer and treat them all as sort of a generalist in terms of how to deal more effectively with mental illness issues. And another is what's called the Memphis model, started obviously in Memphis, Tennessee. And this is the one that we are more closely following. So the idea is to have a baseline training or a basic level of training and awareness in mental illness issues for everybody, every sworn officer, everyone who carries a firearm, who can make arrests.
This is all the city police departments and the sheriff's office. Mm-hmm.
Exactly. So every deputy sheriff, every police officer, including tribal police, and then we've also expanded it into the Kitsap County Jail, because that's a critical part of our public safety system as well. And also CENTCOM, our dispatch center, our joint dispatch center, so that they have a higher level of awareness. So that basic level will be 8 hours of training, and many of those officers have already gotten that training. But we're going to make sure that every officer, and this is about 324 officers countywide, if you include all those agencies together, including the jail, will receive that training, and we'll be ensuring that that training is up to date as we continue into the future. Now, beyond that, we're also looking at specialized training, so something above and beyond that baseline training. And we're going to start with a 40-hour program. It's simply called a mid-training component, mental illness and drug dependency, that our CIOs, or our crisis intervention officers, will attend. And this, again, is just the start of what those crisis intervention officers will do. We've already scheduled that training, and the Bremerton Police Department is coordinating the training, but we're not the only agency. Again, we're just sort of the hub of it right now, but every agency will be involved, including the Kitsap County Sheriff's Office. And that training has already been scheduled. It will be here in Kitsap County this fall. And we've already selected our crisis intervention officers. We had an introduction or a rollout in Poulsbo just a few weeks ago. And again, I have to say, I've been a chief for 10 years, and I've rarely seen the level of joint planning and cooperation and everybody being on the same page as I've seen here in Kitsap County with this issue.
We hear that often, and thank you all for being a team, because it's really important work.
Yeah, and really, it's so often true in government, certainly true in law enforcement, that when we are fragmented and don't work together, we're not nearly as efficient or as effective. We are all working very, very well together in law enforcement in Kitsap County. Every municipal agency, tribal agency, sheriff's office, the dispatch center, the jail, we're all on the same page. And as those CIOs get trained up, become a little bit more adept and knowledgeable about how to deal with issues related to mental illness, What we're going to do then is utilize them 24/7, so that if an incident occurs, let's say in Poulsbo, but their crisis intervention officer isn't working, that CIO might be coming from the sheriff's office or Bremerton or Port Orchard. We're going to share amongst ourselves to ensure that we're responding the best way and the most responsible way. And ultimately, the idea is obviously to keep people safer, keep officers safer, the public safer, and the person involved safer. So it's a great program.
And address the actual issue rather than treating it as though it's a crime, treat it as the difficulty that the person is facing.
Exactly. And as you know, crime is often a symptom of or a sort of a tangent to all of this. And to work with the family a little more effectively and communicate with the family. So again, a great program. We're glad to be part of it.
It is a great program. Thank you for explaining it.
Thank you.
And thank you for being here today.
Sure.
Robin, do you want to tell us a little bit about your New Start Jail Transition Program?
Sure, you bet. I just want to tell you too, Chief Strachan, that several of the folks that we're working with are the same population that you're working with, and I think it's going to be great once we get those services up and running. It'll definitely make an impact on the community. So our New Start program has been a long time in the making, actually, and you probably remember, Commissioner Garrido, we about 5 years ago had applied for a federal grant through Ned Newland, Chief of Police, and the former county substance abuse provider monitor to start an RSAT program in the Kitsap County Jail. And we were actually awarded the funds, and then the funding cuts came down at the state and federal level, and we were never able to actually get it implemented. So it's been a long time in the making, and we're very excited. We will be serving 160 inmates at Kitsap County Jail over the course of 2015, and what we'll be doing is providing assessment, treatment inside the jail, and then reentry services prior to exiting the jail. We'll also have a full-time continuing care clinician at West Sound Treatment Center to provide aftercare services once the inmates are released from the jail.
So talk to me a little bit more about the aftercare services.
So the model that we'll be using is MRT, which is moral recognition therapy, and it's based on making better choices and developing internal motivation for change. And so MRT, motivational interviewing, and then we're looking at a model called T4C, which is thinking for change. All of those will be components of our aftercare and also of our treatment model inside the jail.
So you said that you were going to treat 160 inmates, and that you've been looking at this model for a long time.
That's right.
What kind of percentage success rate do you anticipate?
Well, what we'll be monitoring is successful completion of the jail treatment program, successful completion of the aftercare program, and sobriety for 1 year or longer. And looking at recidivism rates and the impact on the community, less interaction with the legal system, emergency room visits, mental health crisis situations. And so those will all be things that we'll be monitoring with our qualitative and quantitative data as we move forward with this program.
Qualitative and quantitative data and relationships with those that you serve will help us move to a much more positive place.
Right, right.
Yeah. Well, thank you so much for being here with us today. I so appreciate the two of you and our previous three guests. What wonderful programs these are adding to addressing the issues of mental health, substance abuse, and therapeutic courts in Kitsap County. We know that it's going to make a huge difference. The commissioners are committed to continuing this, and all of the practitioners also want to see this be a sustainable program, a sustainable route for us to be continuing. So thank you for being with us today. We so appreciate your interest in this topic, and we know that we will come back and talk about these programs in another year or 6 months so that we can give you another update about their success in Kitsap County.
Thank you.
Thank you.